How do you know if your child has thrush, and what do you do about it? Thrush is super annoying, and there really are a few things you need to know if you're wondering why your child's thrush treatment isn't working. I'm a board certified pediatrician. Make sure you're following along if you want evidence-based tips to keep your kids healthy. We're going to talk specifically about thrush in the mouth. The typical thrush symptoms here are a thick, growing white plaque on their tongue and on the insides of their cheeks. Sometimes thrush can make a kid pretty fussy because it can be a little bit painful, but even worse, thrush can get in the way of good effective feeding. Thrush in the mouth and on the tongue is caused by a yeast called Candida. And because it's caused by a yeast, it can actually make the treatment a little bit trickier than it should be. That's because thrush has a growing phase and a dormant phase. Fun fact, I once met a girl in college named Candida whose parents just thought that was a really pretty word. So thrush treatment has a few rules that are often missed. I mean, we obviously treat thrush in the mouth with an antifungal, but that's not the whole story. Maybe save this video for when your child inevitably gets thrush, because here's where it gets a little bit complicated. I like to treat for a maximum of 14 days, or if your child's thrush goes away sooner, you have to treat for 2 days past when your child's thrush goes away. And that just goes back to the fact that there is a growing phase and a non-growing phase in all yeast infections. You gotta kill those little sleeping spores as they wake up. The other tricky thing about treating thrush in a child is that it can get passed back and forth from your baby to really anything that they put in their mouth. So after 2 days of treatment, you've got to sterilize every binky, bottle, and boob. Leave me a comment about your worst thrush experience, or maybe think about sharing this video to someone with a baby. In the meantime, I'll be thinking about my old pal Candida every time I see a baby with a yeast infection.